This is the trachea and this is a food pipe. When we inhale the air, the lungs will work like this. And when we leave it, it comes to their place. This is the external structure of heart, and this is the internal structure of heart. This is the main aorta. The impure blood comes directly into the heart in right auricle. This is a right auricle, and the blood flows into the right ventricle. From right ventricle, a pulmonary vein is present which enters into the lungs. The impure blood gets pure in the lungs, and the pure blood come into the heart and flows into the left auricle. From left auricle, it goes into the left ventricle. From left ventricle, a systemic aorta is present which supplies the pure blood to all the body parts. Now, Sufia will explain you about the effects of smoking on lungs.
Good morning, sir. As we all know, smoking has become a trend in teens nowadays. So, smoking is very much harmful to our body, but it is very much harmful on lungs. Lungs contain hair-like structures called cilia, which acts like glue inside the lungs to clean the harmful dirt. But when we smoke, a sticky substance called tar is present in the cigarette, which enters into the lungs and gets stick on the cilia, and hence cilia is unable to clean the harmful dirt. And this harmful dirt remains in the lungs and causes harmful diseases and other lung cancer also. Now, Farisa will explain you about the effects of smoking on heart.
Smoking harms nearly every organ in the body, including heart, blood vessels, nose, eyes, digestive organs, etc. Now I will tell you the effects of smoking on hearts and blood vessels. The chemicals in the tobacco smoke and the chemicals in the tobacco smoke harm our blood cells. They damage the function of heart and structure and function of blood vessels. This increases the risk to atherosclerosis. Atherosclerosis is a disease in which a waxy substance called plaque builds upon the arteries. This arteries, then the arteries, because of the plaque, the arteries hardens, and this limits the flow of oxygen, that is bridge blood to our other body parts. Coronary heart disease. This is a coronary artery. Coronary heart disease occurs if plaque builds upon these coronary arteries. Because of coronary heart disease, we will suffer from chest pain, heart attack, heart failure, and many other diseases. There are many benefits if we quit smoking and avoid second-hand smoke. The best way to reduce our risk to heart diseases is to avoid tobacco smoke. Don't ever start smoking. If you already smoke, quit it. No matter how long you have smoked, quitting will benefit you. Don't avoid the second-hand smoke. Second-hand smoke means inhaling the smoke that others release when they smoke. Quitting smoking will lower our risk to atherosclerosis and blood clots.
And hence, we can say that in other words, smoking is like digging their own grave, sir.
So please say no to smoking. If you see someone smoking, please stop them.
Very good.